Let's talk about bunions. And there's probably a couple of treatments out there, somehow shaving it, totally operating it out. And the treatment I very rarely hear, which I saw my father, however, performing for ever since I knew him, and that is whenever he got a new shoe, he immediately would stump a hole in it wherever his little thing was, and the bunion came out, and it was all fine. Anyway, tell us about the treatments for bunions. And you said something in another video that bunions are a sign of arthritis. I'm not so sure you did say that, but that's what I picked up. Tell us a little bit about it.
Okay, all right. Bunion, what most people know, is when the big toe is crooked, it starts crossing over the second toe. And what happens when it starts to cross, you have problems with it moving. Just think of it as a door that's a little bit off the hinge. And you keep opening that door and closing that door, that cabinet, the part of the door starts to wear away. So when that wears away, the door part of the material, the same thing happens in the foot and the big toe. You wear away the cartilage, which is the cushion of the joint. And when cartilage wears away, that's how you wind up getting arthritis. So when you have that toe bending that way and that arthritis starts to form and the cartilage wears away, that produces pain. So our first treatment of choice is to, number one, put somebody in a good shoe and in a good orthotic to balance the foot, correct the way they're walking so this big toe doesn't deviate any further, and help with the motion. You could also... So even if a person has already a bunion, a orthotic might help to make it getting worse or even stabilizes
better?
It stabilizes the foot, meaning the bunion will not get worse. If a person truly wears their orthotic, and a custom molded orthotic, on a regular basis, that bunion will not get worse. And a lot of misconception is even after patients have bunion surgery, they correct the bony deformity by a surgical correction, they still need to wear an orthotic because the bunion will come back. You didn't fix the reason why you got the bunion, then that's foot structure from your arch flattening and different forces. You just corrected the bump or straightened the toe, but once you have that surgery and you keep walking and walking for years later on, people say, oh, my bunion's back. Well, of course it's back. You need it to support the foot so these forces don't play havoc on the big toe once again.
I see. It's like with economics. It doesn't help to do QE1, QE2, QE3, quantitative easing, give money to the banks and to all the other people when the systemic, the source of the problem of not having jobs, not producing enough in the country, not whatever it might be, is not fixed. It just wouldn't work. So you need to fix the reason which creates the problem in the first place.
Exactly correct. All right, so you would start really with orthotics, changing shoes if you have bunion pain.
And by changing shoes, what type of shoes? What are you talking about? Wider shoes, higher shoes, less heels? Changing shoes? What?
Changing shoes meaning a wider shoe. Something that would accommodate and not squeeze the foot, not rub on that bump when somebody has a bunion. Old-fashioned times, what we used to tell people were if you have a bump or the shoe is tight, take it to your local shoemaker and get it stretched. And they make a little pocket so it doesn't really irritate it. On that note, you could put some padding over the bunion, and that will help cushion it so it doesn't rub in the shoe. If you're having pain in the joint, some things we do, like you've heard of tennis elbow, or people have knee problems where they get cortisone shots into their knee or their elbow to help with the arthritis. We also do that in the big toe, where we can give a shot to help, calm down that pain and a little bit of steroid to help with that inflammation. Eventually, we could do physical therapy, which also is another way where the body naturally, we jog the natural elements of the body to help get rid of inflammatory products which causes the pain. And that's ultrasound and medicosonolators and whirlpools and different mechanisms like that. You could treat it with medication. Plain old anti-inflammatories such as Advil or Aleve over the counter would help. And then if all else fails and it's interfering with your life and walking, you have so much pain, then you would be considered a candidate for surgical correction. And when we do surgical corrections, sometimes it's as simple as just taking the bump off, or sometimes the whole joint needs to be realigned, where you actually make an osteotomy or a cut in the bone, realign the joint, put some pins in to hold it together in place, the correction, and that takes 6-8 weeks to heal, and then you go on. But it really depends at what works for you. I'm a big believer in where you are with your pain, where you are in your life, and what you're really able to do. Most people nowadays really can't take the 6 to 8 weeks off from work to stay out to have the bunion done. So we make them as comfortable as possible, and most importantly, you don't want it to get worse. I mean, that's really the main goal.
Right. So you're telling me if a person has a bunion operation, he's out of commission for 6 to 8 weeks? He's like actually in the bed for 6 to 8 weeks?
Well, it's limiting weight bearing. If depending on the type of bunionectomy you do, if you do a simple, just take the bump off and don't realign the joint, they have stitches in their foot for approximately 2 weeks, and soft tissue takes time to heal. Although the skin heals in 2 weeks, you can take your stitches out. The internal portion takes a little bit longer to heal. So there, 6 weeks, it's limited walking. After 2 weeks with that simple bunionectomy, they can go into a sneaker and walk around in a sneaker or an open sandal if it's the summer. But there's still swelling in the foot because internal healing takes place. Now, if somebody needs something done where we do work towards the first MPJ or with the big toe joint at the top of the foot, they'll have a pin in for 4 to 6 weeks to hold that bone in place that we realigned. So during that time, they can do limited walking. They're in a surgical shoe. You cannot get the foot wet while it's in the post-op period at that point. And again, swelling in a foot can take up to 6 months to really get removed after surgical procedures. So really, depending on what the person does, if they're a secretary, they drive to work, it's your left foot and you don't have a clutch, you could probably go to work in the shoe. But if you're somebody who is a hospital worker running around taking a subway, you're not going to work, you're staying out of work. You need to have proper healing, because if you don't do this, you're going to wind up with a problem for life. So you need to be able to take the 6 to 8 weeks out of your life and away from work to help yourself heal properly.
I see. So if you have an office job and more or less, sit and anyway, then you can go with crutches. You can make it into the office. Somebody can drive you maybe if it's your right foot or whatever it is, and you'll be okay. But if you're, let's say, forget it. If you're a waitress or a waiter, or a chef, or as you said, a hospital worker or a mailman or whatever it might be, that's it. You're out.
Right, you're out. Definitely.
Okay. That gives us a good barometer. Well, that explains the bunion. So there are many ways of fixing it, and it's quite I didn't know that orthotics actually help stabilizing it. So if it's at a point where it's not necessarily yet all that bad, then an orthotic with a little bit of some corrections and some things you mentioned here, then that might just do the trick.
Exactly.
So, and even if you do get an operation and 6 weeks out, or whatever it may be, after that, you better start wearing an orthotic, otherwise it comes back again. Absolutely. That's what you're saying.
Absolutely.
All right. Yes. Well, all right. Thanks a lot.